Welcome to you all, and welcome, of course, to our online audience that is also watching us. I hope you had a really fantastic time at the early parallel sessions. I was inspired, provoked, and gone away with lots of ideas to think about. So I hope you also had a good start to the day. We are calling this Reimagining Europe's Health Systems, and that is a co-creation. That is something that doesn't just come from the speakers, it will also be from you, the audience. And at various points this morning, I will be coming to you for your questions and your comments. I also have someone who is watching the online audience, so questions from online will also be very welcome. You are part of this conversation. So without anything further from my side, other than, of course, a warm welcome to everyone on behalf of Friends of Europe, I would like to give you an entrance to the imagination, because our first speaker, Boye Eliasson, is someone who's very well known in the health futures world. He has an extraordinary capacity to take the complex and make it inspiring and interesting and accessible and simple to understand. So, Boye, the floor is yours.
Thank you. Thank you so much, and thank you for the invitation, and thank you for being here. I guess there's a lot of expectation now. You did not warn me about that. So, yes. Do I get my slides? So, I did spend the last 11 years at the Copenhagen Institute for Future Study, leading health, where I've developed many of these concepts that I'm going to talk about. I am from the Faroe Islands, so one of the smallest societies in the world, which is why anything that's bigger than 50,000 people, which is the population there, is just big, so it doesn't matter if it's 50 or 100 million, which is a benefit when you want to work in this way. So what I'm going to try to give with you on the future of health is opportunities and responsibilities, especially for Europe. EU as a global leader, I will touch a bit on, but really focusing on from what to how. So one thing is to define the what, the other thing is to do the how in that way. So here is just a picture of some old commercials. So the one on the left side is a commercial from the 50s in US. It states that you have to smoke Camel in order to be a good doctor. And here is cocaine for 2 days for kids 100 years ago, and cigars for curing asthma. Funny? Okay. But think for 10 seconds, what are you doing in the health system today that your kids and your grandkids and their kids are going to say, what were you doing? That's your task. Call me tomorrow with your answer. Okay, approach here. Build health as the most important societal pillar. So that's what we want to do. Just imagine that you can do that. So benefiting patients, professional populations, and planet. But the purpose here is really to build dignity, equity, security, and prosperity with health. So health becomes a driver for something positive, not something to resolve something negative. Change the mindset. So when we have changes, it is because we suddenly think differently. It's not because we take technology from A to B to C. We change mindset of it. And we are really dependent on echoes of yesterday's mindset. That is our constraint that we need to deal with. We should not forget that we have done huge progresses over the last years. Life expectancy at least doubled. We have almost finished polio cases. Malaria is in half, and you can go on and go on. So we can learn from a lot of good cases. So and many things have never been better, but our sense is that it has never been worse. So, and we have threatening issues, and here the art is to think, what is the future we would want to have? Imagine what it is that would be good enough for us, and not just try to fix what we don't like. And this is really where we need to imagine what it is we want, and then work for it, build it. Here comes the funny thing. We have never had more funding, personnel, technology, knowledge, hospitals, data, and still we are on the verge of the biggest breakdown ever. So what is happening? Why do we have this disaster? It's a mindset crisis. It's not a money crisis. It's not an educational crisis per se, it's a mindset. So we need to move forward from a treatment regime. Today we have somewhere between 85 and 90% in Europe as an NCD disease burden. The hospital system that has given us a lot was based on communicable diseases, accidents, and violence, all acute responses. What we need today are not acute responses. It's early intervention when we see the signs. So we also need to leave the notion of that you are sick or ill. That's a binary thing. You need to enter to keep people healthy. So when we look at this, we all want to cry. But there is a secret. Tears don't change the world. It's the mindset that does. So where do we really go from here? So if we have learned anything, is that it's the great changes of mind that makes our shifts. I love technology. I love to read it. I love to be a part of the technological development. But if you don't have the imagination, you will not be able to apply it where we need it. So here comes the fifth industrial revolution mindset in. First question is, are we doing things right? And are we doing the right things? Sounds easy, very difficult, right? Often we apply, as we heard yesterday at the dinner who were there, we apply fantastic technology on something that's already broken. And we all know that we need to rethink, so we begin to focus on or get away from the late treatment to a health span. And secondary prevention, we have the knowledge to do. So when we have a chronic disease, start early, deal with it. We have knowledge to at least 90% of this challenge. So then when it comes to the fifth industrial revolution, we have the fourth one, which is on new biology, so genomics, omics, all of these things, data, digital functions, imaging, smart materials, but it has been a volume approach. As much data as possible, as much sequencing as possible, not on the outcomes. What do we want to use it for? Does anybody know how much of the produced health data we use? 3%. Probably we spend more money on paying for hosting data we don't use than rare disease. Okay? Priorities. So here we go towards the quality, really focusing on why do we want to use this? We have the technology, we have the knowledge, we lack the purpose. Where do we want to go? So this is really about rebuilding with purpose, setting the direction, and not forgetting that the future is exponential. It's not as we are used to. But one thing is certain, if you don't know where you're going, any road takes you there, but it's definitely not where you want to be. Right? We always move, but where do we want to go? So it's to change our mind and change our course, and here comes the next what if. That's the luxury of having been working as a futurist. You can be a 3-year-old and just ask, what if? And the what if here is, what if we imagine that health was the most important pillar? So this is what builds equity, equality, fairness in society. It's the safety, security, and the inner resilience in a country, sustainable growth, prosperity, reduction of avoidable disease burden, which is the most important part, and we can build digital bridges really to push this forward. So this is a new way of saying, okay, why do we want to apply these things? But we can also apply it to sustainability. Health is the 5th biggest polluter. So if we reduce the burden on the health system, we actually become greener in many ways. So health should also be an active for society, not just for health in itself as we see it, or clinical health as we see it. And it is very simple, you all know it. Can we intervene earlier? It's not about using less money on the same person, it's when do you spend the money? And there we get it totally wrong today. So we are only going in when chronic disease is at the middle stage normally, when we know we should be at the healthy medium risk, at least at the later stage to go in. We have this knowledge, but we don't want to pay for it. Then the most crucial question here is, what are we aiming for? The best health system or the healthiest population? Yeah? All people would respond, of course, it's the population, and then you ask, okay, the last half year, your decisions that prioritize the population over the system were, and there's no answer, because we are incapable of doing that. So this is where we really need to change our mindset. So you could say that history really calls upon us, so we can move from this reactive sick care that we all want to do. We know that. So this is the how question. So how do we get into this proactive, more health span part of going forward? What we did in the Nordic health approach that we started in 2018 and really pushed the first phase in 19 was to say, okay, the trajectory will break down the Nordic systems. So what if we spend half of the money on primary, secondary, and tertiary prevention and the other half on curative, because people will still be ill. So that's not the point is not that nobody should be cared for in the system. And then begin to balance it out and work with it. In the end, this is about reducing avoidable disease burden, which is at least 30%. 30% what comes into our hospitals. But it's also about using technology and knowledge we have. Apply it. We have 90% of the things that we are asking for. So here we can go in and really push forward of Leroy Hood's P4 on personalized, preventive, predictive, participatory, and then add potential on the part and give this to the hands of the individual and saying, okay, let's help you to stay healthy. Because why should it be the hospital that is the only thing that is relevant for your health? That's disease management, it's not health. And this is what we also did. So this is before ChatGPT in 2019, where we built this humanoid model just asking, saying, okay, what if all the relevant data for a person, their personal data, their environmental data, so the exposome data, if we put that in the hand of the individual with some help of some digitization, AI in it, then how can we begin to work with the individual as a participatory part of also producing the data? Because the future is not gonna be happy with only static data. We need real-time data, fluctuations of data that come in, and there's only one that can produce that, and that's you. It's not the system, it's you. And then, of course, you need to aggregate that into a system, so that's what we call the sustainability system, where the individual produces back to the system that makes value out of it, and then it has to come back to the person in some usable way. And here is where Facebook is a good example. I'm not a fan of Facebook, that's not the point. But instant gratification. So make it usable each day, then people produce. If it's not usable for them, they will not produce it. So if we want what we preach, this is the price we need to work with. Is it easy? No. And of course, often we say, okay, this is too complex in technology in different ways. But we already have frames, for instance, with Beauchamp and Childress principles of biomedical ethics on autonomy, beneficence, non-maleficence, and justice. And if we add proportionality, then we should be there. But we need to remember that we produce data to protect and help people, not to buy cybersecurity devices. Okay? That's what we do today. So data is for use. Where we are trying to apply this is to say there are 5 pillars. So let's work with improved technologies reasonably, improved prevention, primary, secondary, and tertiary prevention, improved treatment, really apply and precise on it, but dignity and equity should be the drivers. That's what we really want to push on it. And of course, the sustainability comes into there. But health is also about prioritizing. We can't get everything. So what is it we want to do? We should also remember that we can decide a part of the future. We can frame what future we want, and this is what we really need to push forward in different ways. And we know that if we look at the 5th Industrial Revolution, we see biology, digital data coming forward, and also smart materials and imaging, but we need to combine these things in different ways. And we forget that we have an increased speed, and the development is exponential, something that we in our brains have a huge difficulty in really moving forward. So the question for the future is not if we can do things. We can do a lot of things. I've been involved in genomics for the last 25 years and also seen that progress in that way. Right? The first genome that we got some 20, 25 years ago was $1 billion. And now you do it for 1,000, 800, 500. So the question is not if we can do something, but why we want to do something. How do we focus on that why question? What is the purpose of that? Our biggest challenge is leadership. It's not technology. So we need to grasp technical change, which is where we do something a little bit better, or we refine some things that we know, with adaptive change, where we totally change the way of approaching things and do it. What happens more often than not is that we love the adaptive ideas, but if you want funding, you need to put a technical mindset and business model on it. And that fails every time. So this is super specialization and system thinking together. I have probably met 5 people in my life who can master this at the same time. I'm not one of them. There's no education in this. There's no course, no university class. It doesn't exist. This is what we need to develop as well. Just to show here on, if we just put in on health as treatment services in the middle, cost much more than anything else in it, but we will move into prevention and early detection and consumer health and wellness, which will probably not be inside what we today see as the clinical system. Why should it be? This is about population health. It doesn't have to happen at the hospital. It has to be regulated, yes, but it doesn't have to be there. So I do some of these things in movement health where we work in Latin America, Africa, and Europe, and soon in Africa. One simple example, hypertension, big challenge in Ghana. What do? We put a QR code on the wall in 400 pharmacies. Person goes in, download an app, take a picture, they get the blood pressure. If they're over the threshold value, they get automatically referred to a hospital. It's digital bridges. We didn't build a new building. We didn't invent anything new. We just connected things. So this is what we really try to do in those parts. And then I'm, of course, in a lot of different projects, respiratory health, especially with COPD, third biggest killer in the world, no attention. We're building indexes on that. Gaia is an app for in underserved communities for pregnant girls or young women to help them with different ways. Improve is an IHI project on value-based health and patient-reported outcomes. And My Health in My Hands is actually an EU project based on our human model. And then the biggest one is what we're trying to build now with the Danish Health Science Cluster and Life Science Cluster and WHO Europe on really applying known solutions to Europe in that way. So if anybody wants to collaborate on that, you know where I am in that. And then going to Europe, last question, almost finished. I know it says 0. The ingredients in Europe are here. There are so many things that are very good in the European Union that we can build things going forward. There is also a European global health strategy. I don't believe that we will make a good health in Europe if we don't want to lead in the world. We need to do both of those things. So that's the courage in it. But what is the direction? What is it really we want in it? So health first. So see health as the most important societal pillar. So that's the European Health Union. NCDs, really focus on it. Secondary prevention, dignity, reimagining privacy. The analog privacy we put on digital doesn't work. We can use the human sustainability model, and then super specialization and system thinking is really what we need to push forward. So could our goal just be so simple as reduce the avoidable disease burden? We have the technology, we have the knowledge. I do this in different hats, as you can see. I'm part of the Robert Bosch Academy, Copenhagen Institute, World Economic Forum, World Health Organization. I co-lead the first ever private-public partnership approach with digital health outside of the hospitals. Phase 5 is a decentralized digital clinical trials approach where you monitor people and see how they work. And so just saying that there are a lot of these initiatives that we are trying to connect in different ways and always open to work with anybody who can push this forward. And I'm so happy that Friends of Europe are pushing this. Sorry, I talked 65 seconds too long.
That's perfect. Thank you so much, Boye. And I apologize, I didn't introduce you with all your affiliations. I thought your presentation would speak for itself, and it absolutely does. But you are the Executive Director of the Movement Health Foundation and previously the Honorary Fellow in Futures of Health at the Copenhagen Institute for Future Studies. And boy, you've given us a lot to think about, some really great messages. And one of them is, we have a lot of the tools that we need. It's about smarter thinking. It's about making sure that we're doing the right things and putting health exactly where we want it to be, using it as the societal pillar that will drive so much else.